Okay, so if you were to define the business requirements or the organization requirements that need to be in place for a successful, healthy research infrastructure, what would they be?
Wow, that's a difficult question. It's a good one. Of course, I thought about it preparing for this webinar, and I thought about how can I bring it down to the basics if I would need to explain it to people who are not necessarily into health research and health data. And I think in the end, what you're doing in a health data network is you're bringing together three classes of actors around one concept, which is health data. And you can see them here on the screens. So one class of data is patient. So patient data, it could be even patient-generated data. I think the patient, or as some people call it, citizen, because it's also about health. As a patient, you want to see your own data, but you also want to control who sees your data, who can access it. A couple years ago, we had this law in the Netherlands where the purpose was to establish a national system for health data, and it failed. I don't know if you read this, read about it, but the law was almost passed through, and it failed in the Senate because there was this researcher from University of Amsterdam who looked at the setup, and he saw a lot of security flaws. So people became very concerned. And I think you can see with the GDPR that's coming, there's been a lot of lobbying in the GDPR. It's said to be the most lobbied law in maybe the history of the European Commission for privacy. So people really want to ensure that their data is safe and that it's not used for purposes such as tweaking insurance, what jobs you can get, etc., etc. So from a patient perspective, I think that getting access to your data, but also controlling who can access what, is a key purpose.